Thank you to everyone who might have already joined us. We've got some early birds here. We will begin at 3:15. We're just getting our panelists on and our closed captioners ready. So give us just a little bit of time. We will start at 3:15. Thanks.
Hi, I am not Mike Anderson, but I am the captioner.
Hi there, how are you today?
Good, thank you. My name's Barry, and you will need to enable me to caption, please.
I just did, Barry. Let me know if it doesn't work for you.
All right, hang on one second, please.
Okay. Hi, Dr. Flowers. How are you today?
Good. Can you guys hear me?
I absolutely can.
Perfect.
So just so you know, we are live. We have 2 attendees so far. They're a little early today. We'll start about 3:15, but we're getting our closed captioner. Barry, I can see your check in the subtitles. Thank you.
Good. I'm good to go. So what time will you be starting, please?
3:15. So maybe about 3:10.
Okay. I'll see you in 10 minutes. Thank you so much.
Thanks, Barry. Dr. Flowers, how are you?
I'm good.
Good. Is there anything that you need from me?
I don't think so. So just know that I normally do everything on Teams. So Zoom is a little different for me. I'm used to seeing like the questions on the side here. So I'll do my best to pay attention with the chat and everything. So, but I think I'll be okay.
And don't worry about that either, because Eric Reynolds at the end, we're going to be going through the Q&A section too. So you'll give your presentation at the end. He'll be asking some of the questions that kind of come up most frequently in the Q&A for you.
Perfect. And you can see and hear me okay?
I absolutely can.
Okay. I'm in a new office. I had to switch offices and I'm like, oh, it's my daughter's pictures. On the Teams, it's smaller. It only shows like this much.
I know. It's too funny. I love the color of that one wall though.
Yeah, it's fun. I moved down the hall, but the problem is it shows my coats. I should probably fix that.
That's
but all right. I can't. I was supposed to. They were supposed to go like that, where you can see. It's all right.
It's okay.
It's all good.
All right. So we'll start about 3:15. We're just getting our attendees in and all of our other panelists. So
excellent.
All right. Thank you for being here. Thank you to all of the attendees who are here today. I see some familiar names. We will begin at 3:15, so you've got a little bit of time to grab some water, or if you're in my boat, maybe a little coffee to keep you going. But we will start about 3:15. We're just getting everybody else set up here on our panelist side. Thanks, everybody. Thank you to all the attendees who are here. I see some familiar names there. We will get started about 3:15. We're just bringing our panelists online right now, as well as our closed captioner. So we'll be back at 3:15 to start up our presentation. Thanks. Thank you again to our attendees for being here. We will begin at about 3:15. We're just getting our panelists online and getting our closed captioning ready. So again, thank you for being here. Hi, Marisol, how are you? Oh, I can't hear you. Maybe it's me.
Are you able to hear me now?
Now I can hear you.
Okay,
We're all set.
perfect. Thank you.
Thank you.
I'll mute myself.
Okay. So attendees that are in attendance, nice to see you all. We will be starting about 3:15. As you can tell, we're getting our panelists and presenters online right now and our closed captioners ready. So please just give us a few minutes. We'll start at 3:15. Again, thank you to all of our attendees who are already with us today. Nice to see you all. We are just getting our panelists on board, making sure that their technology is working, getting our closed captioner set up, and we will begin at 3:15. Hello, Mr. Reynolds. Can we try out your microphone, make sure it works?
Good afternoon, Marianne. How you doing?
Great, thanks. It's working just fine. So like I said, we'll be back about 3:15. Just hang in there with us for a little bit as we get set up. Thanks. Thank you again for joining us, everyone. I see we have some attendees on already. We'll be starting in about 5 minutes. Want to make sure that our panelists all have the technology working that they need. Hello, Mr. Vasquez, how are you?
Hi, how you doing?
Good, thanks. Just wanted to see if you're going to be using your camera today, and if so, if we could just test that out, make sure it's working.
Yeah, just getting all set up here, getting the presentation. But yeah, it should be coming up for you now.
Perfect. Hi, how are you?
Good. How are you doing?
Good, thanks. All right, so we will start about 3:15. We are just going to get our closed captioner on in a few minutes here, and then we will be ready to go. Mr. Reynolds, I'll let you know when we are ready. And for any of our attendees, if you do have questions throughout this presentation, feel free to put them in the Q&A there at the bottom. We will be answering some questions at the end. Hopefully a lot of those questions will be answered through the presentation that Dr. Flowers will be doing today, but you can start putting those in the Q&A if you'd like now. And we'll just be starting about 3:15 as we get the rest of our group set up. It's nice to see so many familiar names in the attendee list.
I just want to mention Dr. Flowers. I'll drive the presentation if you'd like. If you prefer to have it otherwise, let me know, but I'll share the screen.
That's perfect. Thank you.
Okay, great.
So Barry, I just want to make sure you're there for our panelists, just so that you're aware, where it says Mike Anderson, it's actually Barry. He's our closed captioner for today. Helps if I also turn on my video. Barry, just wanted to make sure that you were back and you are set to go for closed captioning. We'll give it another minute. We're not starting until 3:15. So thank you to all of our attendees. Again, I see some familiar names. We appreciate. Oh, hi, Barry.
I had myself muted. I'm so sorry. I'm back.
No worries. Okay, just want to make sure you're there. Thank you so much.
Sorry about that.
No worries. Okay, so thank you to all of the attendees who are with us today. Again, don't forget you can put your questions in the Q&A down there at the bottom, and we'll be answering a lot of those at the end. But at this point, Mr. Reynolds, we're only at 3:12. We're going to start at 3:15, but we are ready on this end to start whenever you are.
Thank you, Marianne. Appreciate it. Let's go ahead and wait till 3:15. I've been watching the attendees or the participants, and it seems like it's continuing to increase. So as much as we like to get an early start on things, let's give people the opportunity to join us at the appropriate time. Okay, my computer just flipped over to 3:15, so let's go ahead and get started. Good afternoon, everybody. My name is Eric Reynolds. I'm the Director of Risk Management here for Ventura Unified School District. Really appreciate everybody joining us today for this COVID-19 vaccine presentation. I will just go over a couple of items and then I'll turn it over to our partners at Kaiser Permanente. We're going to have, the webinar will be an hour long. The presentation will leave some time for questions. If you were with us a bit earlier, Mrna did mention you can type in your questions in the Q&A throughout the webinar. I will be looking at those as time allows and trying to answer a few. We'll also kind of collect some of the most popular ones and maybe answer those out loud for the whole group at the end as time allows. I wanted to go over, before we get started with our presentation, I want to go over some recent developments with vaccines because I know there's been a lot of new exciting news that has happened literally in the last day or two with regards to Ventura Unified and Ventura County Public Health and Ventura County Office of Education. I thought it was important to get those out there up front. That might eliminate some questions. Most people know that all the superintendents in Ventura County have been working very closely with Ventura County Office of Education and with Ventura County Public Health to get education people vaccinated. That includes all employees in education. And in the paper today, Ventura County Public Health has stated that it's their goal to make sure that all employees in the educational sector receive at least their first vaccination within the month of March. And then over the last couple of days, Ventura County Public Health has actually opened appointments for education employees before the March 1st timeframe. So you can actually go on the Ventura County Public Health website. Jody will be putting that link in the chat and make yourself an appointment to go set up your first vaccine injection. There are going to be other ways that we're going to be able to do that. Kaiser will go over where they are at in their phases right now, and that will apply for both Kaiser people who have Kaiser insurance and non-Kaiser members as well. And then, like I said, we're working in conjunction with Ventura County Public Health and Ventura County Office of Ed to set up a third possible way of maybe just some vaccines for Ventura employees. Those final details have not been set yet, but kind of keep a lookout for emails from Mrna from the communications department. There'll be more details coming on those. We will be taping the presentation. So if you want to watch it again, or if somebody wasn't able to join us, we'll be sending out information on where to watch that at a future time. That should probably be ready sometime tomorrow. I think that was about all I had for now. I want to just move forward and thank Mrna for setting this up for us. I want to thank Kaiser Permanente, in particular, Salvador Vasquez. He is our senior account manager with the Gold Coast Joint Benefits Trust. That's the organization in which the Ventura Unified School District obtains our insurance benefits for employees. We work closely with Sal on all sorts of things, including in employee engagement and education. So thanks, Sal, for setting this up. Marisol Quintano is also here. She is our engagement specialist. She also works closely with Sal and all the districts that are in the Gold Coast Trust. Thanks for all your help, Marisol. And then I really wanted to thank, in particular, Dr. Danielle Flores with Kaiser. She'll be here for the presentation. I'll read her information here, and then I'll turn it over to you, Sal. So Dr. Flores is the physician in charge of the Mission Hills office building and a physician ambassador for Panorama City. Dr. Flores earned her medical degree from the University of Southern California, Keck School of Medicine. Dr. Flores, I won't hold that against you, being a former Bruin. She completed her internship and residency training at the LAC USC Women's and Children's Hospital Pediatric Residency Program. She's been a Kaiser Permanente physician since 2008 and is board certified in pediatrics. She's fluent in Spanish. Currently, she is one of the assistant area medical directors for the Panorama City Service area. Thanks again, Dr. Flores, for taking time out of your busy schedule to be with us here today. Sal, take it away. Thank you.
Yes, thank you very much, Eric. Sorry, I don't want to correct you. I just want to make sure I introduced Dr. Flowers correctly for the meeting, for this meeting. But yes, I am Sal Vasquez. I am the account manager that works with Eric and the school district to really try to get information such as this one today. And we're really excited for this opportunity to meet with you all today and go over the COVID-19 vaccine program as it pertains to Kaiser, but also as it pertains to our communities and everyone outside of Kaiser. Give you all an update on where we stand on the vaccine, and also mainly the efficacy, the safety of the vaccine. And so Dr. Flowers will really go into some great detail on that, and also spend some time with you and answer your questions. As Mary Ann shared, the best way is to ask your questions in the chat, and we will do our best to answer them throughout and even at the end. So I want to thank you all for your time today, and I will hand it over to Dr. Flowers to get us started.
All right. Hi, everybody. Thank you. Yes, I'm Danielle Flowers, and I am born and raised in the San Fernando Valley. So I've spent a lot of my life out in Ventura County. Both of my daughters have most of their sports out there. So I spend your areas near and dear to my heart, and I'm pretty much there every weekend. So, and yes, I'm a Trojan. I was there for undergrad, medical school, and residency. So that makes me a USC lifer. So I'm definitely fight on. All right. So let's go here. We can go to the next slide. And I am definitely here to give this information and definitely answer questions, because that's the most important part of today. And really, we are here to just talk about specifically today, the Pfizer and the Pfizer Moderna vaccines. So I know there's a lot in the news about the Johnson & Johnson vaccine. We don't have enough information yet to be able to present it. So today is going to be focused on Pfizer and Moderna. Go to the next slide. So the main things that we're going to address today: how is this vaccine developed and tested? What are the COVID-19 vaccines? Who can get the vaccine and when? Why should you get the vaccine? What are the side effects to look for? And what should I expect when I go to get my vaccine? So we're going to address all of those things today. So how are these vaccines developed and tested? I know there's a lot of questions out there about this, so I want to address it. I think the most important thing that I want to talk about is that every single vaccine goes through the same type of testing, right? So our Food and Drug Administration, the FDA, sets rules, and there are 3 phases that every vaccine, so yes, our Pfizer and Moderna vaccines that we're talking about have gone through these, but every vaccine that we give our children, every vaccine that adults take have gone through these exact same type of phases and studies. The only difference for the COVID vaccines is because of the pandemic, instead of some of the phases and the manufacturing being done one after the other, which takes a long time, they were able to do some of them at the same time. So the timeline was faster, but the actual phasing and the amount of people tested and knowing that it's safe, that is all the same as with every other vaccine that we give. So really, there's phase 1 and phase 2, which starts with, you'll see the numbers on here, 20 to 100 healthy volunteers. And then phase 2 is several hundred volunteers. Well, when all of this started, there were people that came pouring out asking to volunteer for this vaccine, because so many people were ready to say, I'm willing to try this so we can move forward and get back to the lifestyle that we were used to. So it was really easy to get people signed up to get these phases up and running. And once, the phase 2, where the vaccine is given and we're able to make sure that the right immune response is being created, then we're able to roll very quickly into phase 3. And you can see on here that it shows that, the Pfizer phase 3 had over 43,000 participants. The Moderna phase 3 had over 30,000 participants. So huge amounts of people were being studied. And as we knew that the vaccine was safe and it was working, they were able to start manufacturing it. So, and you'll see down here, there's lots of details about how the vaccines are made in the batches, and how the manufacturers have to test everything, and how the FDA that has to inspect everything, including the facilities that they're made, to make sure that it's safe. And if there's ever anything along the way that doesn't pass, the entire operation would have had to have been shut down and everything thrown away. So that is the same standard for everything. So the standards at which these vaccines were created is not different than anything else we've ever done. So we can go ahead and go to the next slide. So we all hear a lot about the EUA, the Emergency Use Authorization. And really what that is the way the FDA was able to more quickly be able to do the different levels of manufacturing it faster. Because of the pandemic, the FDA was able to say, we're going to use the Emergency Use Authorization to basically quickly develop and manufacture the vaccine instead of doing develop, wait, manufacture, wait. We were able to, once we developed and saw that it was working, manufacture it so that there was not the big lag in time in between. So that's the emergency use authorization is. And the FDA reviews the results of the Pfizer and Moderna trials and before they can ever approve anything for use. And all the data has to show for any vaccine, and especially these are no different, that the vaccine is safe and effective. And that's what is required to get the EUA. So we can go to the next slide. So has Kaiser Permanente been involved in these trials? Absolutely. We have been involved in phase 3 of the Moderna and the Pfizer trials. In Southern California, Northern California, there's Kaiser Permanente in Washington and other places around the country. And we've been involved in trials everywhere. And we're involved in ongoing trials. There's teen trials that are happening right now. And Kaiser Permanente is involved in the 12 to 15 and then the 16 to 17-year-old trials. So we are definitely involved in being a part of making sure that these vaccines work and that we are, part of making sure we're moving on to the next phase of all of this. So, and we also have, the important thing is that Kaiser has an interregional infectious disease expert group that reviews our research data and confirms that these vaccines are safe and effective. So the FDA is reviewing, but we also have our own internal group that is looking at all the data to double check and really make sure that we agree with everything that's being done with the research. Go ahead to the next slide. So what are the 2 COVID vaccines? We've discussed this. This is our Pfizer and the Moderna. These are the ones that everybody's hearing about. And the ones that you're hearing on the news are the Oxford, or otherwise known as AstraZeneca, the Novavax, and the Johnson & Johnson vaccine. So those are the ones that are going through the exact same phases of trials that the Pfizer and Moderna have already completed for adults. So we already know that Johnson & Johnson's in the EUA process. So we're going to learn more about that in the few weeks to come. And that'll be a whole new presentation for you to see how we're going to utilize that vaccine. But today we're focusing on Pfizer and Moderna. So you'll see this again shows the amount of participants, and it shows you how many people got COVID during the study, and it tells you 162 of, so let's, for example, the Pfizer column on here, it says of the 43,000 study participants, 170 people got COVID-19. Okay. And of those 172 people, 162 of them had been given the placebo, meaning they got a shot in their arm that they didn't know what it was, but it was actually not containing the vaccine. Okay. So they really didn't have any protection. And 8 of them had the protection and still got COVID. So that tells us that overall, there's a 95% vaccine efficacy rate. That means it's 95% effective, which is amazing. And same for Moderna at 94.1% effective rate. So when we think about effectiveness, when we're comparing vaccines, we're really excited when the flu vaccine has a 60% efficacy rate. Okay, so for something to be at above 90% is amazing. And the measles and mumps rubella vaccine that we give all of our kids, that's at a 97% effectiveness rate. So that's how we know where we're to kind of compare what we're talking about in terms of how excited we are. So when the numbers came out that these vaccines were 95% effective, that's a great number. And that really lets us know that it's going to work. And we can go ahead and go to the next one. So this is the part that is interesting. It's that these 2 vaccines are what are called mRNA vaccines. And so the big message that I want you guys to learn about and remember today is what M and mRNA means. M means messenger. So this vaccine is essentially sending a message. What it does is you inject the vaccine into your arm. And what it is it's a message that tells your body hey, it sends in this little tiny thing called a spike protein, which is a little protein that exists on the COVID-19 virus. And and we send a message to the body that tells it how to make little spike proteins. So it's just a message. It doesn't do anything else other than send a message that your body should make these little spike proteins. And then we have our immune system in our body that says, hey, what are these tiny little spike proteins? That's not normally here. I need to build antibodies so that I can fight those off. So your body makes mRNA, little spike protein. So the mRNA tells your body to make the little spike protein. Then your immune system says, no way, I don't want that in here. So it makes antibodies to fight it. So that if you are actually exposed to the true COVID-19 virus that contains the true spike protein, your body already says, hey, I have seen a spike protein before, and I already know how to fight it. So then you are already protected. So that's how it works. It just sends a message. So your immune system remembers it's seen this spike protein before and is able to fight the true virus when it gets to you. So we'll talk about more of this as we move forward, but it's really, that's the big message. So it's an mRNA vaccine because it's sending a message. This message is not getting into our DNA, and I'm going to go through all of those different things too. It's just allowing our immune system to create a response so that if we are exposed to the true virus, we are able to fight it. So we can go to the next slide. So this is real quick facts that I want to make sure we hit on, so in case the way I explained it didn't make sense. So how do the mRNA vaccines work? They teach our cells how to make a protein, that spike protein, which is just a piece of protein that triggers an immune response inside our bodies. And that immune response produces antibodies, and that's what protects us from getting infected if the real virus enters our body. Okay, so that's what we want. We want our immune system to be ready and to fight it. Do the vaccines use live COVID-19 virus? No, there is no live virus that is injected into anybody because it is just, as I said, a messenger RNA. It's a little tiny, sends a message, just teaching our cells on what to do. There's no live virus involved. So do the vaccines affect or interact with our DNA? No. Our DNA is located inside the nucleus of every single cell. And this vaccine doesn't go anywhere close to the nucleus. It's making a little tiny protein that's on the outside. So we don't have to ever worry about it affecting our DNA or any genetic makeup. That's not how it works. It's not going anywhere close to that. We can go to the next slide. So who can get the vaccine and when? And we already heard some good news for you guys about being able to get your vaccine soon, and that's very exciting. So really, Kaiser Permanente has been following along with the California Department of Health, and we have been following the same phased approach. And right now, Kaiser Permanente and everybody else, we're still in phase 1A for any healthcare workers or long-care term residents who still need to be vaccinated. And we are vaccinating individuals ages 65 and over. So all Kaiser Permanente facilities are doing 65 and over. And we are waiting to have the vaccine allotment, the supply ready to be able to move into education, childcare, emergency services, food, and agriculture. So it's great to hear that the Ventura County is going to offer it. And hopefully Kaiser Permanente will have the vaccine supply to be able to do it soon after. And really what happens with us is when people become eligible, we will blast it out on all of our different ways with our hotline and on kp.org, and through anything you'll be able to see when we're offering all of those different types of vaccines. So we do have first of all, we have our website that's listed on there, the kp.org /COVID vaccine. So that's constantly updated, letting people know where we're at in the tiers on who we're vaccinating. And then we also have a vaccine hotline that also will give a whole message on where we're at, timeline, and those are updated pretty much weekly. And you can get to the website or this hotline 24 hours a day, 7 days a week. And so that's the best way to find out if the Kaiser Permanente facility closest to you is vaccinating for your particular tier. Okay, we can go on to the next slide. So what are things to think about when you're getting your vaccine? And there's a lot of people who think, wait, but I've already had COVID. I don't think I need to get vaccinated. Well, actually you do. We highly recommend it, but you need to wait for the 10 days after you're done with isolation, and then you're okay to be able to get vaccinated. And the reason why is there's people think, well, if I've had it before, then I'm immune to it. We don't know how long natural immunity lasts. So we don't want to put people at risk of thinking that they're immune from having the disease and that immunity has actually gone away. So you always want to get vaccinated, even if you've had the infection, to make sure you're giving yourself more protection for a longer period of time. Now, the only time that you need to wait 90 days after a COVID-19 infection is if you had to get the monoclonal antibody or convalescent plasma treatment. People who receive those two medicines, that medicine treatment, have to wait 90 days until they get vaccinated. But if you had COVID-19 and didn't receive those, 10 days, and then you can go, and you have to be doing better, of course. You're done with your isolation, you can get vaccinated. So allergies, this is something that has been very confusing out there. The only time there's an allergy that contraindicates or means you can't get or you shouldn't get the vaccine, or maybe you need to talk to your specialist about it, is if you've had an anaphylactic reaction to another vaccine. Not to being food allergy, not to having seasonal allergies. This is full-blown anaphylaxis where you need an EpiPen and medical treatment from a different vaccination. So that's a conversation with your primary care doctor and allergist to see if you do qualify or if this is something you should not get. Everybody is going to have a 15-minute observation after they get their Moderna and the Kaiser vaccine, just to make sure that there's not going to be for any immediate reaction. And then if there's been a history of a severe allergic reaction, but still deemed safe to get the vaccine, it's a 30-minute observation. Quickly, just to remember, if you just happen to have already gotten another vaccine, you need to wait 14 days till you get your COVID vaccine. There has to be a 14-day buffer. And then in terms of pregnancy and breastfeeding, they're still in studies right now, but really it's a personal decision to discuss with your doctor. The American College of Obstetrics and Gynecology does say to vaccinate right now. Women who are pregnant are at very high risk for complications if they get COVID-19. So at this point in time, most of the literature is pointing towards that it's better to be vaccinated and safe from complications if you happen to contract the disease. And then immunosuppressant medication. Right now, there's no immunosuppressant medication that would make it so that you cannot get the vaccine. But of course, if you have any questions, you can talk to your specialist and they will give you further details. So we can go on to the next slide. So yeah, I talked about a lot of this, but really the most important message I want everyone to get is pregnant women are at increased risk of severe COVID illness. And so, that's something that we really want to be careful for. And it would be, if you're in an area where there's high levels of COVID-19 and a high chance of getting it, it's something you really want to be very careful about and consider vaccination. We can go to the next slide. So why should I get the vaccine? Because COVID is everywhere and you might not know it because people can be asymptomatic carriers. So we want to make sure that we're protecting ourselves, because what we see isn't necessarily what's actually going on. And protecting us is protecting everybody else around us. So, we don't want to get it and then accidentally give it to somebody with a chronic illness who can get really sick from it. So the idea of, oh, I can get it, I'll be fine. We don't want it, but not know we have it and get other people sick. And, really all of us matter. All of us making a choice to stay safe and keep those around us safe is good for the whole and good for our entire community. And, like I said, the vaccine's 95% effective. So this is our pathway. This is our light at the end of our tunnel. This is our way to get back, for you guys to get your kids back in the classroom and get back to the teaching that you love to do, the educational systems that you love. So we can go to the next slide. So, the additional benefits, this is the way to end the pandemic, prevents other people. And it's definitely a safer way to build protection than actually getting the illness, where there's, many potential complications if you get the illness and you don't know how long immunity from the illness lasts. Vaccination is a much safer way to build protection. And the vaccine is safe. All of these vaccines are safe. Next slide. So side effects. The Pfizer and Moderna vaccines all come with some side effects. And on average, they last for about 1 to 2 days. And what's interesting is some people have 0 side effects and some people have some side effects that last a couple days. So there's a reason why there's percentages of how many people get all of these things. And I will tell you, as a physician watching all of my healthcare colleagues, all of us get vaccinated at the same time, everything on here was absolutely true. There were people who felt nothing after both injections, and then there's some of us that didn't feel great. I'm one of them. I'm not gonna lie. I had about 48 hours of some fatigue and some body aches and chills and headache. I had it both times, and my arm hurt, but it went away. I mean, like exactly what it said on here. By the second day, is it gone? It was. Then I felt like nothing had ever happened and 100% better. So in my mind, I was like, all right, I know this vaccine is working. This is exactly what they told me was going to happen. I know I planned the vaccine so I could rest the next day, lots of fluids. And I knew that was my mind telling me, this is okay. This is my chance to rest and I'm going to be better tomorrow. And I know that, you know, after this is done and I'm vaccinated, that means I'm safe for myself and for my family and for my patients. So, you know, you do have to wait for about 15 minutes after your vaccine just to stay for an observation period. And that's, it goes quick, I promise. And there are allergic reactions that occur. And if you do happen to be someone who carries an EpiPen, please have it with you. But usually at all these sites, all the EpiPen, they have epinephrine available. There's all sorts of, emergency kits available. But these allergic reactions the extreme allergic reactions are extremely rare. And anyone who has a severe reaction to a first dose should not get the second dose. So I'll tell you, through the Kaiser Permanente system, if you have a severe reaction after the first dose, it automatically triggers a visit with one of our allergists, and you have a visit with them and you go through everything, and they really determine if this was a severe allergic reaction where you shouldn't get the second dose, or if this was something else that maybe you can get the second dose. So in our system, it's set up so that you talk to a specialist. So we can go to the next slide. And when you go to get your vaccine, you'll be provided with something called vSafe. And really what that is, it's an app on your phone that the CDC created that allows you to check in after you receive the vaccination and really give more information about any side effects or the fact that you don't get side effects. It's another way for us to be able to keep track of how people are feeling after the vaccine. And there's also information on there to call and get more if you want to talk to somebody. And it keeps track and tells you when to get your second vaccine if it hasn't already been scheduled. So the vSafe is handed to everybody who gets the vaccine, no matter where you get it. Next slide. So what do I expect when I get the vaccine? For Pfizer and Mrna, you have to expect to get 2 vaccines. And you get 2 of the same vaccine. So if you get Pfizer for dose number 1, you need to get Pfizer for dose number 2. If you get Mrna for dose number 1, you need to get Mrna for dose number 2. So the Pfizer vaccine is about 21 days apart between the 2, and the Mrna vaccine is about 28 days apart. So when you schedule the first vaccine, if you're doing it through Kaiser Permanente, when you get your first vaccine, you will get an appointment for your second vaccine on that same day. Some of the different county facilities will mail you your appointment or do it a little bit differently, but you should expect to get an appointment, you know, within a week or so you know when you're going back. And you need to go back on the day that they told you to go back, because you have to get your second vaccine at the latest 42 days after your first vaccine. But ideally for Pfizer, it's day 21, and for Mrna, it's day 28. You will also receive a vaccination card, and we want you to hang on to that. And really what we're asking people to do is make sure you take a picture of it. So in case you lose it, you have it on your phone, so that when you go for your second dose, they can see the card. If you're a Kaiser Permanente member, you're going to get the card as well, but of course it is going to be in your medical record and you'll see it immediately. I know I've looked at my medical record, both of my vaccinations are already on there. So when I open my kp.org and you open for your immunization record, it's right there. So I of course have a picture of the vaccination card, but it's in our records immediately. But after you have your vaccine, the main thing, like can't expect that you're going to get to take your mask off and go back to regular life. We aren't there yet. We are slowly getting there, but until further notice, even if you've been vaccinated, you need to continue to wear your mask out in public, continue to practice social distancing and good hand hygiene to make sure we're keeping everybody safe. We are not at a point yet where we can go take our masks off. All right, next slide. So I love this slide. So I'm going to spend a second here and I'm going to really kind of go through it word for word because these are the things that I get asked every day. So I am the physician vaccine coordinator for the Panorama City service area. So this is my life right now and I love being a part of it. And these are the biggest myths that we get asked about all the time. So I definitely want to spend time talking about it. So can I get sick with COVID-19 if I get the vaccine? The vaccine cannot give you COVID. Because like we talked about before, it's not a live vaccine and we're not putting the virus into you. Remember, that's the mRNA that's just sending the message to teach your body how to create the immune response. The other myth, I already discussed this, I already had COVID-19, so I do not need to get vaccinated. You still need to get vaccinated. You just need to wait 10 days from your initial diagnosis to make sure you're no longer contagious to go in to be able to get vaccinated. And because we don't know how long immunity from the disease lasts, so we want to make sure we're giving everybody as much protection as possible. And we discussed this already as well. The COVID-19 vaccine will alter my DNA. And this is absolutely not true. The COVID vaccine does not interact with your DNA because that mRNA is just sending that message to teach your cells to make a protein. It does not, remember, your DNA is in your nucleus, which is inside the cells, and this messenger RNA never goes inside any cells, never goes in there. So no effect on your DNA or your genetic codes. The COVID-19 vaccine has a microchip in it and is made to control and track people. This also not true. There is no microchip and the vaccine will not track or gather any information. Your cell phone is already doing that for you. The COVID-19 vaccine is not safe because it was developed and tested too fast. And remember, we talked about this too. All 3 phases were done the same way we would do for any vaccine, but instead of doing them sequentially, 1, 2, 3, then production of the vaccine, we were able to be in phase 3 and manufacturing production of the vaccine at the same time. So we were able to act just at the same time it would have taken to do everything, but because it was done together, the vaccine came out faster, but it was not developed or tested too quickly. None of the steps were skipped. Hold on, were there a couple? Can you go back? Yeah, okay, sorry. Oh, this one comes up a lot. The COVID-19 vaccine will cause infertility. There is 0 link to infertility at this time. We are continually from the clinical trials and everything else that we're seeing as more and more people are getting vaccinated, there is 0 risk or link to infertility with the COVID-19 vaccine. I've discussed this already. I do not need to wear a mask after I get vaccinated. But actually right now, we still need to wear a mask until we have more information, until we have a higher percentage of the population vaccinated. And I don't need to get the COVID-19 because I'll be protected by herd immunity. So herd immunity is achieved through vaccinations or immunity developed through previous infection, but we don't know if previous infection leads to true immunity. Vaccines create herd immunity without causing the illness or any resulting like complications from actually having COVID. So herd immunity doesn't work in that respect. So we can go to the next slide. So really, if you guys already heard about how you can get your vaccine scheduled soon, which is very exciting. If you're interested in only doing it through Kaiser Permanente facility, you can just keep checking on our website and calling the hotline, and we'll let you know when we're ready to do the education sector. So questions in the chat?
Dr. Flowers, first of all, I want to apologize for butchering your name earlier. And
okay.
thank you for your time. I definitely am not representing the Bruins very well this afternoon. There are, Marianne and I have done the best that we can to answer a lot of questions. And the ones that came up a bit, I'll review them later, but there are 4 questions that, well, they just went up to 6. There are 4 questions. Yeah, 5 questions that are medical questions that if you would be kind enough to answer, that would be great. Either you could read them or I'll read them to you, whatever you prefer.
I don't see them, so why don't you read them to me?
You got it. Okay. The first question is, can you discuss how each of these 2 vaccines work with the new variant of COVID that appears to be in California that I've heard is more dangerous and perhaps has the ability to evade the antibodies generated by the antibodies in these vaccines?
So all the studies so far are showing that that the vaccines are working with this current California variant. So it's not saying, this current studies are not saying that our vaccines that we're using are not working.
Perfect. Thank you. The next question is, would it be wise to obtain a test before getting vaccinated just in case?
No, I don't think it's necessary. We're not testing anybody before. And if you're symptomatic, that's one thing, but asymptomatic, no, unnecessary.
Thank you. The next one says, if we get the vaccine, can we still contract COVID and pass it on to someone else?
The answer to that is yes. So it's 95% effective. So there's still a 5% chance that you can get COVID. And I'll tell you this, I have a friend, a physician friend, who contracted COVID since having both of her vaccines, but she had a very mild case and was feeling better within a couple days, which is the purpose of this vaccine. So yes, there's still this 5% chance that you can get something, but if you get something, it's going to be very, very mild. And your chance of being hospitalized or dying from COVID is essentially zero. So that's the one thing you have to remember. So yes, you can still get something, but the chance of it being bad is zero. In terms of giving it to somebody else. So even if you're vaccinated, you can still be a carrier. So we all can carry the vaccine to somebody. So that's why we still have to be masked and we still have to be social distance and practice hand hygiene. So at this time, and we can all do that with any virus. So, we see that happening all the time where, like, think about when we have young kids at home. So, one child's in like preschool age and you have a baby at home, and then the toddler keeps getting the baby sick from what they're bringing from preschool, but the toddler's fine because the toddler's already had the cold X, but the baby hasn't, but they're a carrier. So, we can all be carriers of viruses and bring things home. So that risk is still there.
Thank you. I think one thing to add on to that, and you mentioned this earlier, but it might be worthwhile mentioning again to anybody who may have joined us a little bit late. Would you be kind enough to mention again how effective these vaccines are, even compared to like the normal flu vaccine?
Absolutely. So Pfizer, 95% effective, Moderna, 94% effective, and we are ecstatic when our flu vaccine is 60% effective. So that shows you a big difference. And the measles, mumps, rubella, the MMR that we give all of our kids at age 1 and age 4, that's 97% effective.
Perfect. Thank you. Okay, the next question. I heard that those who have a shellfish allergy should not take the vaccine. Is that true?
No, that is not true.
Wouldn't that be something you might want to ask your own doctor about?
Yeah, they can. They can ask their doctor to see, but there's shellfish allergy is not a contraindication.
Okay.
But anybody who's needed an EpiPen or carries an EpiPen needs to bring that EpiPen with them to the vaccine appointment.
Perfect. The next question is really an HR question, so I'll come back to that. We'll let you take the medical ones. The next question, what I read today, someone asked, should we be waiting for one vaccine over the other? And I actually read the answer to that one today, but I'll defer to you.
Absolutely not. Whichever one is available, take it. Between Pfizer and Moderna, they are equally fantastic. So I would not wait for one versus the other. And most locations, you don't know what you're getting because it just depends on the vaccine supply that is available that day. But between the information we have between Pfizer and Moderna right now, they both have similar side effects and they both have similar efficacy. So to me, they're the same. To the studies, they're the same. Perfect.
Okay, next question. If you have an allergy to sulfa medication, is it safe to get the vaccine?
Yes.
Okay, one more question. Are you seeing any of the complications from COVID-19 after the vaccine, even if you have a mild case?
What's the question again?
I think you kind of already answered that. Basically, if you get a mild case after the vaccine, or if you happen to get COVID after you've been vaccinated, the odds of that are low, but if you do, generally your symptoms should be very mild.
Very mild, yes. And chance of hospitalization and death are 0.
Okay, perfect.
Mr. Reynolds, we had one more question that's been coming through quite a bit, but it's not here, but we've been getting emails about them. And that is because obviously we have children and students within our stead most days. When are we expecting, we're hearing that children ages 12 to 16 may get it this coming fall and possibly late in 2022 for the little ones. Do you have any information on that?
So this is near and dear to my heart because I have 12 and 14-year-old daughters. So, and I'm a pediatrician, so I get asked this all day long. So we are currently in, all the studies are happening right now. So my daughters actually were signed up to be part of a Mrna study. They have an appointment on Tuesday of next week, and they are devastated because they've already reached their max quota as of tomorrow. So they're getting canceled out of it. So there are multiple, like the 12 to 17-year-old, multiple studies that are finishing their phase 3 right now. So we're moving along in those big kid group. When they're going to get released, I don't know. We keep hearing late summer, early fall at the latest for the older kids. I mean, and really think of it. I mean, I don't know about you guys, but my 14-year-old daughter is 2 inches taller than me and way bigger than me. So, you know, I'm not sure how I think in those older teens that are adult size, I think it'll come quickly. We just need to finish those studies and get the FDA to do the EUA on those. And we're starting the studies. I've seen studies on 5 to 12-year-olds. I have not seen a whole lot of studies start on the 0 to 5 yet. So I think that what needs to happen is we need to figure out what's going on in the 5 to 12-year-old range, and then they'll be able to adjust it for the the little ones. Because obviously, if there's a way for them to get less vaccine, or you know the amount be less, we have to wait. We have to see about that. So more to follow. I think the goal is vaccinations for definitely for the middle and high schoolers, you know, fall, and then school age shortly thereafter. I think it's going to take a little longer for the little tiniest ones, the 0 to 5s. I think we're going to have to wait a little while.
Perfect. And thank you, Maria. And that was a question that I was going to ask as well. Okay, next question. Is there a common denominator as to who is more likely to have a problematic response to a vaccine?
No, there is not. It is completely different. And you have family members, you have, you know, we have, like, I look in my healthcare world, we have multiple physicians who are siblings. They come from the same family, they get the same vaccine, one gets side effects, the other one doesn't. Everybody's different. Everybody's different.
Perfect. Now you covered this already, but there is a question. So let's cover it again, if you don't mind.
Okay.
Is it safe for pregnant women or women who are breastfeeding to get the vaccine?
Yes, as far as we know, but that's something that you should discuss with your physician to weigh out all the pros and cons and make sure you're making the decision.
Perfect. Next question. This is the last medical question, and then there are a couple of questions again that are kind of VUSD HR related. So I'll kind of try to take those. Is there any protection after just one vaccine?
Yes, there is. So the studies show that even just one dose of Moderna and Pfizer gets you, I think, almost 65 to 70% of effectiveness. So it definitely, within 2 weeks of that first vaccine, you have some protection, but you don't get to that 95% till 2 weeks after the second vaccine.
Perfect. Perfect. Okay. Like I said, the last two questions are kind of more VUSD related. So I'll try and take those. Dr. Flores, or I'm sorry, I keep saying that, Flowers, Dr. Flowers, Marisol, thank you very much again. Is there anything, I'll kind of go over what I went over again at the start, just for people who might have joined us a little bit late with where VUSD is at, and take these last couple of questions. Is there anything you guys would like to add in closing?
I just want to thank you all for having me. Yeah, go ahead.
Sorry, I just want to mention, Eric, and as I think Dr. Flowers mentioned as well, this is all evolving, and we, you know, especially around the phases and where vaccine supply is for Kaiser, it continues to expand. So we are hopeful to get to the level of the county in Ventura and really get more vaccines out and include the education sector. As soon as that does happen, members, you know, as Dr. Flowers touched on, we do communicate this out to members in any way that we can, kp.org, and also via email. If you're registered on kp.org, you'll get that. If not, highly recommended to do so. That's going to be the best place to kind of find out information, and also to make appointments at Kaiser for for the vaccine. I know it sounds like you're probably going to be able to get it, you know, prior to that, but just wanted to call that out. And, you know, also I will communicate it to you, Eric, as soon as we expand our vaccine supply. As soon as I know that this is top of mind for everybody, and especially you all for the noble work that you do. I want to thank you for that. And I know that it's, of the utmost importance to get that information over to Eric and so we can relay it to you. So that's all I had. Thank you everyone for your time and the opportunity to come speak with you all.
Dr. Flowers?
I just want to thank you all. And if you have any other questions, you can reach out to me. I'm here and I'm excited for you all. This is a very exciting month ahead for your team.
Awesome. Thank you both again. We really appreciate it. I will let you guys go, and then I'll try and answer the last couple of remaining questions that just pertain to internal stuff.
And Eric, just want to mention, if there's anything that comes up after we leave or anything like that, feel free to pass it along to me and I can work with Dr. Flowers to get those answers for you. So not the last time to ask questions, everybody.
Perfect. Thank you. Appreciate it.
Eric, thank you, Marianne.
Bye, everybody.
Bye.
Okay, for those of you who are still on the presentation, I will go ahead and ask or answer the questions that are remaining. And I'll go over the points that I went over at the start of the presentation on other options for vaccinations right now. So the first question is, if an appointment is scheduled during the school day, will teachers be covered with a substitute that is not deducted out of their P&L or sick days? And the second part of the question is, can an appointment be denied to a teacher if there aren't enough subs available to cover the Zoom teaching lesson? I think the first part of that question is, this is kind of an evolving situation. I don't think we have a set answer for the first part of that question on what type of leave will be used. I'll be reaching out to our HR folks, so maybe we can get an answer out to everyone on that question. The other question, or the other part of that question is so Ventura Unified doesn't know when you're making an appointment. So there is no way that Ventura Unified can deny somebody making an appointment. You're going to be making your appointment through either Ventura County Public Health website, or when Kaiser is ready to roll out, they'll let me know and I'll let all the USD people know. And the third option is, like we talked about at the very beginning, all the superintendents in Ventura County have been working hand in hand with VCOE and Ventura County Public Health, and we are all trying to get vaccinations available for all staff in a third possible route. So Ventura County Public Health, Kaiser, and this third route would be each district working with VCOE and Ventura County Public Health and perhaps a separate vendor to set up a place and time where our staff might be able to go. Again, there'd be no charge for that. Those details are still evolving, and when that is all set, we'll definitely be notifying people. Okay, let's see. Last question on here, and then let me point out real quickly too. The two questions that we had come up quite a bit was documentation. What documentation do I need? You can go on the VC Recovers website and it actually says exactly what's required. But I can tell you that you'll need a pay stub. I know firsthand people have been going just with a picture on their phone, and that's worked. But there's lots of different sites. And I'd hate for somebody to go and have one site say, oh, that's not good. So what I would recommend you doing is printing out a pay stub, taking a picture or taking your driver's license with you, so a photo ID. And then if you have a school ID, like a badge that we have here at the district office, take that too. But right now, what I've been told by the people I know personally who have got the vaccination is you're not getting grilled on what your documentation is. If they have the vaccine, if you've made an appointment, your name's on the list, you show up, they're pretty happy to get your shot taken care of. And then the other thing was posted several times in the questions was, well, they're out of appointments. Ventura County Public Health is out of appointments. That is true. However, what happens is if people cancel during the day, those appointments come back up. And every day they're updating those appointments as they get more vaccine. So I would, if you want to get the vaccine and you don't have an appointment yet, I would recommend going on at maybe first thing in the morning every day to see if there's appointments available. If you live in Ventura, you might have to drive to Oxnard. You know, it's that type of thing. But there's numerous sites across the county. And as long as you live in the county, you can go to any of those sites. Okay, so next question on the chat. For VUSD, if we live with people who are unable to get the vaccine, can secondary teachers still qualify to stay on distance learning if we return to hybrid? How are we handling the tiers priorities for who may be allowed to remain on distance learning? So when we go back, we still have people on distance learning for the remainder of this year. So I don't know if I'm 100% following your question. If you're on distance learning now, until your distance learning assignment ends, you would be able to stay on that assignment regardless of you being vaccinated and or someone in your house.
This might be a middle school or high school teacher who's on distance learning because there is no hybrid yet. That's my guess is what that's coming from. Could they stay on distance learning? And I believe that that's an HR question.
Correct. So when we opened hybrid, there was a whole process for who got selected or who applied for distance learning. And I'm sure HR will have a similar process when we go back to secondary. A lot of those items are determined by need, like how many students need and are requesting distance learning. Then in the past, with this distance learning, there was what's called tier 1 and tier 2. And HR will explain all of that. But basically, if you have a medical reason that you cannot return, that will be considered. Okay, next question. If you get the first one from one source, I assume you have to get the second one from the same, or can you mix? It's a good question. Basically, the way I've heard it is that when you get your vaccination, the type of vaccination is recorded in the computer system. And then you're notified on when to get your second vaccination. And when you go in, that will dictate pretty much when and where you go. Okay, I'm scheduled to turn in proof of COVID testing in March. It is still required. At this point in time, all the testing requirements are still in place. Most employees have been paid to test, and we're not exactly sure how quickly people will be vaccinated. Where the employee testing goes, again, is an evolving situation, and everybody will be updated. But as it is now, the employee testing requirement is still in place. Next question, is vaccine mandatory? At this point in time, it's not mandatory for VUSD. Another evolving situation and scenario, and there's all sorts of legal ramifications for both VUSD and private employers, not just for employees, but also for students. So if there's any news on that front, to the contrary, everybody will be notified. Okay, can you modify your schedule on a day of an appointment for distance learning to offer a different time to teach? I definitely think that would be a question for you to first take up with your site principal and then go from there. Okay, looks like that's all the questions. I've covered everything that I had written down. Mrna, do you have anything to add?
No, one more, a couple more questions are coming through, but yes, just to re-clarify, as soon as we find out from the county when and how you can sign up for those vaccines that are being put aside for our VUSD employees, we will let you know right away. That is separate from the general Ventura County that you can currently go to try and find an appointment. So again, we will send you that information. We will let you know as soon as we can. And one of the things we will do is remind staff of the times that teachers are in class. And ask those staff members who are not teachers to try and do their vaccines at a time when the teachers are in class that way we can free up some of those non-class times for our teachers. So we'll send all that information as we get closer.
Perfect. Thank you, Maria. And again, either path is an option, and as well, Kaiser will be a third option. You don't need to go with one. A couple more questions. No, you will not test positive for COVID-19 after you get the vaccination. I specifically asked that question of Ventura County Public Health in the past. If you feel sick after the second day, will it come out of my sick leave? I would imagine at this point in time, that probably would be the case. Again, evolving situation, I will follow up with HR on that. To be clear, when are we required to get tested again if we are on distance learning? Right now in February, so it's a good question, and thanks for asking it. The testing requirements have changed and evolved as reopening has changed and evolved. We originally wanted all employees to be tested once every 2 months because that was the California Department of Public Health mandate. That mandate has changed a little bit. Then we ended up paying people either 2 or 4 times, depending on if they were at a site or not. Then we changed it to basically try to emphasize testing currently for elementary and people who are currently seeing kids. And for secondary, we pushed the tests after the initial test out till past April 1st. So yeah, just kind of keep standing by. You will definitely be notified as to when the next testing will be required.
And just so everyone knows, we will be downloading the questions that everyone asked in the Q&A, and then we will get some answers for you, especially those HR questions, so that when we do send out our next communication about vaccines, hopefully we'll have some of those questions for you in there as well.
Okay, one more question. What time is it? It is, okay, we have time. Secondary teacher, I'm leading an in-person small group. I need to get tested by April 1st. Yes, that is correct. All good. Great. Thank you, everybody. I hope this was helpful. I see a couple of comments that it was. So I'm really excited about a vaccine being available to everybody. And that should be really, really helpful. Thanks again, everybody, for your time.